Your age is not the number in your passport. It is defined by the condition of your blood vessels. And here is what is genuinely concerning. Between two people of the same chronological age, the gap in vascular age can be as much as 20-30 years. One person has flexible, resilient arteries. The other has rigid, calcified vessels, almost like concrete. And this is often what ultimately determines who will experience a heart attack or a stroke, and who will not. I am Dr. Helena, and today I will walk you through how blood vessels actually age, why this process often goes unnoticed, and most importantly, how you can understand the current state of your vessels right now. Why blood vessels age prematurely? Most people assume that vessels age simply because time has caught up. But in reality, the picture is far more complex. Blood vessels do not age by the calendar. They age because of processes that take place inside us every single day. And what matters most is that these processes begin very early, sometimes long before any noticeable symptoms appear. The earliest stage almost always goes unnoticed. At first, the endothelium is affected. This is the thin inner lining of the blood vessels. It is responsible for their elasticity and proper dilation. Simply put, a healthy vessel is not just a pipe. It is a living structure that constantly adapts. But under the influence of stress, elevated glucose, and inflammation, this layer begins to function less effectively. In research, this is referred to as endothelial dysfunction, and it represents the very first step toward vascular aging. For example, a review on PubMed shows that endothelial dysfunction precedes atherosclerosis. That means function changes first, and only afterward. Structure. This is an important point. At an early stage, a person feels almost nothing. At most, subtle, non-specific signals that are often attributed to fatigue. For example, you may get tired more quickly. You may tolerate physical exertion less easily. Your blood pressure may fluctuate from time to time. A general sense of low energy. This does not look like a disease. But in some cases, these can be early signals. Although on their own, they do not confirm anything. If the process continues, the vessel wall begins to change. Inflammation develops. The body attempts to repair the damage. And at this stage, lipids, calcium, and connective tissue begin to accumulate. The vessel gradually loses its flexibility. This is where what medicine calls arterial stiffness begins to appear. It is considered one of the most accurate markers of biological aging. Studies published on PubMed show the greater the stiffness of the vessels, the higher the risk of heart attack, stroke, cognitive decline, and even overall mortality. And most importantly, this indicator often predicts risk more accurately than cholesterol levels. In other words, a person may have normal lab results, but their vessels may already be aging at an accelerated rate. Now the most important question, is it possible to track this in advance? Yes, and this is exactly what is rarely discussed. There are several methods used in medicine. I will explain them as simply as possible. 1. The first is pulse wave velocity. It sounds complicated, but the idea is simple. The heart ejects blood and a wave travels through the vessels. If the vessels are soft, the wave travels slowly. If they are stiff, faster. And the faster it travels, the older the vessel. This is a recognized method used in both research and clinical practice. 2. Augmentation index. It shows how the pulse wave is reflected. Also a marker of stiffness. 3. Coronary calcium. Calcium scoring. A CT-based scan that measures the extent of calcium deposits in the vessels. It is one of the most well-studied prognostic markers. Evidence from PubMed confirms elevated CAC is directly associated with a higher risk of cardiovascular events. 4. Intima media thickness. It is assessed using ultrasound of the neck vessels. A simple and widely accessible method. However, not everyone has access to these tests. That is why there are indirect signs to pay attention to. Rising blood pressure, decreased endurance, memory decline, cold hands and feet, headaches. Take blood pressure, for example. If it starts to increase with age, it is often associated with reduced vascular elasticity, although the relationship can work in both directions. Or consider recovery after physical effort. If you used to climb stairs without difficulty, but now experience shortness of breath, this may also be a signal. These signs are not specific, but they are signals that should not be ignored. In routine clinical practice, doctors usually do not assess vascular age as a separate parameter. More often, they step in when changes have already become noticeable and clinically significant, when clear abnormalities appear that require treatment. But for us, it is important to understand these processes in advance, before the changes become obvious, because it is at an early stage that we can influence the situation and take action while the vessels still retain their ability to adapt and recover. Now to the most practical part. What influences vascular age? If your lifestyle includes high sugar intake, chronic stress, lack of sleep, smoking, and low physical activity, vessels tend to age faster. But there is also good news. This process can be slowed down. Here is what helps: regular physical activity, a diet with adequate healthy fats, blood glucose control, reduction of inflammation. And yes, nutrition and micronutrients also matter, but not as a magic solution, only as part of a broader system. And here is a point that is rarely considered. Vessels are not only about the heart, they are also about the brain. There are studies showing that arterial stiffness is associated with worsening memory and cognitive function, that is, vessels age, and the brain begins to receive less effective blood supply, and this happens gradually. I once had a patient who came in simply to have his heart checked. Nothing in particular was bothering him. He led a generally healthy lifestyle with no harmful habits. He was taking vitamin D, but during the evaluation, it became clear that his vessels had already lost a significant amount of their elasticity. And this is exactly the kind of moment that changes how you think about health. Because on the surface, everything can look perfectly normal, but the underlying processes are already in motion. We cannot stop time, but we can influence how our bodies age, and blood vessels are one of the few systems where these changes can actually be modified. Your passport may say one thing, but your vessels may be telling a very different story. And the question is, what story are they telling about you? In the next video, we will explore another critically important factor in vascular aging, nitric oxide. And you will see how adjusting just a few factors can help support vascular health. Take care of your vessels, because they play a key role in how long and how well you live.